Hello everyone, and welcome back. I'm Rae. So there is a story out of DRC and Guinea, all within Africa, and it's a report about Ebola outbreak. I'm going to read for you one by the International Medical Corps. So according to their report that they released recently, nearly after 4 months of the end of DRC's 11th outbreak, which was last year in November, they registered a new Ebola case. There is a new outbreak that has been confirmed in North Kivu, which is North-Eastern Congo, in a town called Butembo, and this was reported on 7th of Feb. Samples collected from a woman in her mid-40s were confirmed by the Ministry of Health in the Congo to be of Ebola virus, and this lady passed away 72 hours later with symptoms of the virus. A test of semen had been collected from this lady's spouse, who is a renowned Ebola survivor and is reported to have turned out negative 5 months ago. But sometimes, according to this report, a false negative result can appear. Preliminary results suggest that the current outbreak is linked to the previous outbreak in this region. So the source of this current outbreak is still being investigated. The first case of this lady who was brought to the hospital, who unfortunately later passed away, she was in a hospital called Katwa Health Facility. So along the way, during the interactions, 3 more people got infected, and 2 of them unfortunately also died, and another one was a nurse who is also currently infected, but who has been responding positively to the treatment. But according to the report, this nurse had previously not received the Ebola vaccine, so that is the reason why she was able to catch the disease from the patient. If we look at the situation in Guinea, Guinea has declared its first Ebola insurgence since 2016. So on the 14th of Feb, 7 cases were reported, 3 were confirmed and 4 were probable. So the government declared an Ebola outbreak in a place called Nzero Kore, that is a town or a village in Guinea, but initial results had shown the presence of Ebola in a town called Gukedu. So the government of Guinea, in joint cooperation with the Ministry of Health and the National Agency for Health Security, are putting up a quick response team together to be able to curb the disease, have all the containment measures in place. And this town of Nzero Kore is on the border with Sierra Leone and Liberia, so that poses a challenge or a possibility of cross-border infections or transmissions. According to the report of the International Medical Corps, this international organization has provided screening and referral units since August of 2018, and they have aided more than 2 million screenings for Ebola and 1.2 million screenings for the corona. They are going ahead to provide prevention and control support to 196 health facilities in the Congo, and they're also putting together a quick response team in Guinea. USA was also very quick to say something according to these outbreaks, and according to the White House statement, they say the outbreaks require swift action to avoid catastrophic consequences. But WHO also said they shipped out Ebola vaccines to Butembo town, which is in Kivu, which is a region that is affected in Congo, and they are setting up, the storage equipment and training personnel to be able to vaccinate the locals against Ebola. The way the Ebola virus spreads is that it goes through someone who is already sick, who is visibly sick, or someone who has already died. If someone comes into direct contact with the blood or the body fluids of such a person, then they are able to get the disease. That's how it spreads. According to WHO, Ebola has an average case fatality rate of 50%. So meaning if people get Ebola, half of them are most likely to die. But of course it can also depend on the outbreak. So this is not a pleasant story, because Ebola has disturbed very many African countries, especially DRC and some countries within West Africa, over the years. So if you are a prayerful spiritual person, we just lift our brothers, in the spirit, and wish them a quick recovery and all that. But share your thoughts and let us know what you think in the comment section. Check out my YouTube channel at Rae Kembabazi, my channel is at Rae Kembabazi, and see you on the next story. Bye.